Welcome to Podocyte Talk, bringing you timely updates from the world of kidney research. In this episode, we begin with a real-world comparison of two widely used therapeutic classes in type 2 diabetes and chronic kidney disease, GLP-1 receptor agonists and SGLT2 inhibitors. Both drug classes are recommended for their cardiovascular and renal benefits, but this study aimed to assess their comparative effectiveness in reducing progression to kidney failure and mortality. Using Taiwan's National Health Database, researchers identified over 79,000 patients with type 2 diabetes and reduced eGFR. After propensity score matching, 14,182 patients, equally divided between GLP-1RA and SGLT2i users, were followed for a median of 2.5 years. The study found that those initiating SGLT2 inhibitors had a significantly lower risk of progressing to kidney replacement therapy compared to those receiving GLP-1 receptor agonists. The difference appeared more pronounced among patients with more advanced kidney dysfunction or significant albuminuria. Interestingly, there was no difference in overall mortality between the two groups. These findings provide real-world evidence supporting the preferential use of SGLT2 inhibitors when the primary therapeutic goal is to delay progression to kidney failure, especially in those with higher kidney risk. We then move to a detailed post-hoc analysis of the FIDELITY dataset, which combined individual-level data from the Fidelio-DKD and Figaro-DKD trials. This study explored the efficacy and safety of Finerenone in patients with type 2 diabetes and chronic kidney disease, with particular attention to changes in estimated glomerular filtration rate 1 month after treatment initiation. Among nearly 13,000 patients, changes in eGFR were classified into 4 groups: those with more than a 10% decline, a slight decline, a modest increase, and a more than 10% increase. While Finerenone use was associated with a greater chance of early eGFR decline, the cardiovascular and kidney benefits of Finerenone were consistently observed across all eGFR response groups. The analysis showed that early changes in kidney function did not diminish the treatment effect of Finerenone. Whether patients had an eGFR drop or increase after 1 month, the risk reduction for both cardiovascular and renal composite outcomes remained similar. This suggests that an initial fall in eGFR should not lead to premature discontinuation of Finerenone, as its long-term benefits are preserved regardless of early eGFR behavior. We close this episode with a prospective cohort study evaluating the association between dietary carbohydrate intake and mortality in patients receiving maintenance hemodialysis. The study included 1,044 patients from 8 outpatient dialysis centers in China and assessed dietary intake using 24-hour dietary recalls conducted over 3 days. Carbohydrate intake was expressed as a percentage of total energy intake and categorized into quartiles. Over a median follow-up of 45.6 months, 352 deaths were recorded, with more than half attributed to cardiovascular causes. The findings showed that patients in the highest quartile of carbohydrate intake, those consuming 72.1% or more of their daily calories from carbohydrates, had a significantly greater risk of both all-cause and cardiovascular mortality compared to those in the lowest quartile. A similar trend was observed for CVD mortality specifically. Notably, when carbohydrate intake was combined with dietary energy intake, patients who had both high carbohydrate and low energy intake faced the highest mortality risks. These results highlight the potential dangers of disproportionate macronutrient consumption in dialysis patients and reinforce the need for balanced dietary strategies that consider both macronutrient quality and caloric adequacy. Join us on Podocyte Talk as we continue to bring you the latest insights into kidney disease research and treatment. Check the description for links to the studies discussed in this episode, and stay tuned for more insights into kidney disease research and clinical innovations. Tune in now to stay informed.